Hi, my name is Tara. I'm going to do my skills validation for eardrop, eye drop, and also for a rectal suppository. First, I would check my Cardex, my physician's orders, and my MAR, make sure those all match up. I would check my 5 rights: my right patient, right route, right drug, right amount, and right time. I would wash my hands, gather my supplies. I'm going to need gloves, hand sanitizer. I'm going to need some paper towels, my suppository, and my drops. And as I collected these drops, I also did my second check of right patient, right time, right route, right drug, and the right amount. I'm going to knock on the door, enter my patient's room, and I'm going to explain to my patient that my name is Tara, I'm your nurse today. I'm going to be applying your ear medication, your eye drops, and also I'm going to give you a rectal suppository to help with your constipation. I want to do my third check right here. I'm going to check my patient and make sure I have the right patient, make sure I have the right drugs, make sure it's the right time to be given these medications, right route, and right dose. I will also check to see which eye needs to have the drops, and it would be actually both eyes today, left and right, and 1 drop in each eye. So I'm going to administer the eye drops first. First, I would lower my bed railing, make sure my bed is a comfortable working level. I'm going to provide for hand hygiene. I'm going to don clean gloves. Make sure my patient's in a supine position, and then I'm going to have them turn their head over. I'm going to clean the eyes first with either, you can clean the eyes either with a warm washcloth or a warm paper towel as well. You want to wipe from inner to outer on both eyes. I would dispose of that. I would provide for hand hygiene again, and I would don another pair of clean gloves. I'm going to administer the drops, and I want to have another paper towel to hold underneath the eye. I'm going to do the left first. I'm just going to take the eyelid, bottom eyelid, and hold it down. And I'm going to just put 1 drop in, and make sure my patient's looking up at the ceiling. That helps out a lot. Then I'm going to hold pressure on the lacrimal duct for a few seconds just to make sure that those drops are staying in there. And I'm going to have him turn his head towards me more. I'm going to do the same thing on the left eye. Hold the lid down, provide 1 drop in there, and I'm going to hold pressure on the lacrimal duct. Okay, and that concludes for the eye drops. I would remove my gloves, provide for hand hygiene, and then I'm going to go ahead and administer my ear drops to my patient. On the MAR, or on the Cardex, it indicates that he only needs the ear drops in the right ear, and it's 2 drops in there. So I would have him in a lateral supine position, and I would have him turn to where the affected ear is facing upwards. I would grab my drops, and then I would pull, if this were a child, I would take the earlobe and pull it down and out. And on an adult though, you would take the pinna and pull it up and back. And then I would apply 2 drops in there, and I would apply some cotton balls in the meatus of the ear. And then my patient, I'm going to have them stay in this position for at least 5 to 10 minutes so those drops are well absorbed. And I would provide for hand hygiene, remove my gloves and provide hand hygiene. And then I'm going to let my patient know after that 5 to 10 minutes I would come back into the room and I would do a rectal suppository. I would have them roll over, or have them in a left Sims position, and I would take their right leg and drape it, or bring it upward over their left. I would also provide for a Chuck's pad on the bed just in case anything does get on the sheets. That will prevent that from happening. I would wash my hands, put gloves on. I'm going to take the suppository out of the package and I'm going to lubricate it. Make sure I'm not getting any lubrication on my gloves. I'm going to expose the buttocks, and I'm also going to take the gluteal fold and pull that back so I'm exposing the anus. I would then insert the suppository. I would have my patient take a deep breath at the same time as I'm inserting it. And I would insert it to the umbilicus, towards the umbilicus, and I kind of in a twisting motion. I try to not cause any pain for the patient, so I'd be very gentle in doing that. And once that's completely inserted, I'm going to hold the buttocks shut and for a few seconds, just so when they are doing some deep breathing, there's no urge to expel that suppository. Then I would go ahead and have my patient just stay in this left Sims position, and they can be laying down, and I'm just going to raise the railing. I'm going to take my gloves off, provide for hand hygiene. And I would give them their call light. I would let them know, let me know if they do experience that or have a feeling that they want to have a bowel movement, to call, press the call light, and I'll be in to assist with that if they need any help. And I would go ahead and document for my eye drops, my ear drops, and the suppository, how the patient handled it. And at this time, I would document the 6 right as well, would be the right documentation. And that would conclude my skills validation.